Hi everyone, today I'd like to talk about dementia. I think dementia is an important topic in healthcare, given that the population in the United States is aging. We have a lot of baby boomers that are retiring, and of course dementia is always a concern. There are different types of dementias. The most common one is Alzheimer's disease, which accounts for up to 80% of dementias. There's also Lewy body dementia, frontotemporal dementia, dementias related to Huntington's disease and Parkinson's disease. There's also dementias related to vascular disease, which of course we call vascular dementia. The common feature of all the dementias is a progressive decline in cognitive function, which severely interferes with daily function as well as independence, such as decline in language, executive function, complex attention, perceptual motor skills, and social cognition. So what are the signs and symptoms of dementia? One of the most common complaints family members have of their loved ones is forgetfulness. Patients who also are exhibiting signs of dementia also have trouble with retaining new information. So at times you can tell them a recent event and they'll forget about it. They also tend to have trouble with handling complex tasks such as managing their checkbooks. Their abstract reasoning abilities start becoming impaired, so their math skills start declining. Spatial ability and orientation are also impaired, and so patients with dementia tend to get lost in familiar places. Language ability is also impaired, and so word finding difficulty becomes a problem. Patients with dementia also start developing changes in behavior, and so family members will often complain that their loved ones are moody or depressed. While these signs and symptoms are common in dementia, there are other diseases that can mimic dementia. Diseases such as delirium, depression itself can cause a pseudodementia, and of course drug use can also mimic dementia. So how do we diagnose dementia? It's important to obtain a thorough history from the family members, as they're the ones who most likely will recognize the patient's decline in function. It's also important to obtain a drug history, as a lot of the medications, prescription and non-prescription, can also impair cognitive function. Cognitive testing such as a mini mental status exam is also a useful tool in helping to shed light on a patient's risk for dementia. Of course, having a thorough physical exam is also important, as it helps us distinguish whether the patient has a dementia due to a neurodegenerative condition such as Parkinson's, or a vascular dementia related to stroke. Neuroimaging is also important in the evaluation of dementia. Although it is not diagnostic for dementia, imaging such as MRI or head CT does help the clinician in distinguishing dementia from other diseases such as stroke or subdural hematoma or normal pressure hydrocephalus. While there is no cure for dementia, depending on the type of dementia, there are some treatments available to help manage the disease. Aside from medication, there are also other ways to help mitigate the disease process, such as staying physically active, getting enough rest, avoiding drugs and alcohol, and staying socially engaged. So this was just a short overview of dementia. If you suspect your family member may be having signs of symptoms of dementia, please have them see their doctor as soon as possible for evaluation.